felt throughout the course of the game tonight? All right, we've talked about the DL for the Dodgers and how many guys have been out, so we thought we'd talk about the science of hamstrings. And joining us now is Dr. Seth Gamradt from the Keck Medical Center of USC. He's an orthopedic surgeon. Listen, I took some medical classes when I was in college. I took physiology, I took human anatomy, and as I remember, the hamstring is a group of tendons that's contracted by 3 posterior thigh muscles.
Exactly right.
And as my professors knew then, and it's still true today, I have no idea what that means. What is it?
Well, that's a great segue to the anatomy section of this segment. You know, the hamstrings are 3 muscles, and the key to the hamstrings, why they're susceptible to injury, is that they span 2 joints. They span the hip and the knee. And so when a guy is sprinting, these muscles are subjected to rapid and extreme contraction and rapid extreme lengthening. And what happens is when the guy is sprinting, right before that lead foot is about to hit the ground, the muscles lengthening and contracting, it puts him at risk for strain injuries.
When you talk about lengthening and contracting, is the muscle itself, you kind of flex the muscle, and then most of the time when it pulls or strains, is it when it's then relaxing through your stride, or is it usually when you're trying to strain it?
Well, what the hamstring's trying to do when you're sprinting, it's slowing down knee extension. So it's lengthening while contracting. And that's why it strains when a guy is, sort of reaching out for first base or really trying to get after it, trying to stretch out a double.
Dr. Gamradt, what's the difference between a strain and a tear and a pull?
Well, that's a great question. Those are basically loose terms that we use in the medical profession and you use in the media to describe the severity of injuries. And basically, it's really a continuum. So anytime a guy's going to miss time with a hamstring injury, we usually get an MRI. And the MRI allows us to classify the injury based on the cross-sectional area involved, the length of the muscle involved, as grade 1, 2, or 3, and how severe are those injuries. Is it going to cause a guy to miss 1 to 3 weeks, 2 to 4 weeks, or is it a real tear injury where there's a gap in the muscle and he's going to miss 6 weeks or more?
So why does it never go away? It seems like if you blow one time, you're going to do it again. So at another point in your career, it might be beer league softball when you're way done with your career, but you're doing it again.
Sure. What the risk is, so a hamstring re-injury rates, depending on the study you read, are 12 to 31%. And the reason that is when you get an injury to the muscle, there's fibrosis and scarring, and that places that area of muscle as well as the muscle along its entire length at risk for re-injury.
We saw Matt Kemp pull his hamstring last year. It was pretty severe. And Steve made the comment that once you pull your hamstring, you're just more susceptible to do it again, and you're really never 100%. Does it heal all the way back?
Well, I think it heals most of the way back, but the number one risk factor for hamstring injuries is probably having had one before. So you're right in that one injury places you at a higher risk for another.
Yeah, the worst news there is you just agreed that Steve Lyons was right about a medical term.
And you tried to say that you were a medical student, so we're even.
I just took some physiology classes. What can you do? How about prevention? Because, look, as we walk through the stands, Dodger fans always come up to me and say, well, what's going on with the training staff? Why all the hamstrings?
Right.
What can you do to prevent it? Is it preventable?
Well, a controversial topic, and there's no real consensus on the best way to warm up or stretch prior to activity to prevent hamstring strain. Well, all I know is that even in this age of year-round conditioning with both the team staff and elite players' private training staff, we're still getting these injuries. So it's a combination of flexibility, core strengthening, and avoiding fatigue that's going to really prevent these injuries. But there's no magic bullet at this point.
And it's not contagious, right? These guys aren't giving it to each other in the clubhouse because we're seeing an awful lot of it these days.
I hope not.
All right, Dr. Gamradt, thank you very much. Dr. Seth Gamradt from the Keck Medical Center of USC, breaking it down and explaining what hamstrings are all about. We come back, off-season renovation of Dodger Stadium.